Hello, my name's Chris. I'm an Australian GP, and I thought that I might take it easy this week with my videos because it's a little bit crazy at the moment in healthcare. And I thought I'd do a video that I've seen so many before me do. I'm certainly not making this up as like the pioneer of it, but I'm going to be reacting to a couple of Google searches. So the most searched for. It's lighthearted, it's fun, and maybe we'll still learn something along the way. So if you're interested, keep on watching. I've decided to start with do GPs. Now, one of the problems is GPs is GPS. So I'm gonna have to ignore a couple of, navigation inquiries along the way. But the very first one I can see here is, do GPs do COVID tests? And the answer is some do. At my practice, we used to. We also used to be a COVID testing practice as well, a respiratory clinic, which we're not anymore. But some GPs do and some don't. It really depends, especially here in Queensland, on the availability of our protective gear and the swabs themselves. Do GPs need internet? I'm going to assume this actually meant do GPS need internet? But the answer is yes. GPs do need the internet. A lot of what we do involves online messaging, looking up guidelines, sending emails. So yeah, the internet's pretty much non-negotiable at this point. Do GPs remove warts? Some of us do. It depends on the size of the wart, the location, especially for some of us. Most GPs will do what's called cryotherapy, which is where we burn off or freeze off, depends on how you look at it, the lesion in question. But yeah, some GPs will remove warts and some don't. Do GPs do skin checks? Most of us, yes. As you can see, there's really a wide range of what GPs will and won't do. As for skin checks, we're all trained to do skin checks. Some of us, including myself, do extra training in skincare medicine. So I currently have a certificate in skin cancer medicine. You can get certificates in dermoscopy, which is using the device to look at the skin cancers under the dermatoscope or the derm skin scope, like microscope. And some people do even more advanced certificates and diplomas and even masters in skin cancer medicine. So the answer is probably yes. Do GPs get paid for prescribing? No. So there is certainly no kickback, no payment we get for doing anything but seeing the patient. The way GPs are paid is by item number, so depending on what kind of service we've provided. And if you're interested, I do have a video on all of that. But regardless, if you see me for 20 minutes, regardless if I prescribed you something, what I prescribed you, if you get a vaccine, anything like that, you'll be charged the item number for that 20-minute consult, except in some circumstances wherein it might be a mental health consult, that's different, or a pregnancy consult, that's a different number as well, or if I stitched you up or something like that. But no, prescribing something, regardless of what it is, how many things you get prescribed, we don't get paid by the pharmaceutical companies or anything like that. So that's a myth. No. Do GPs do PCR tests? You can tell we're in the era of Lerona, can't you? Again, see question 1. Some of us do. Do GPs do stitches? Yes. I actually quite enjoy suturing people up. It's much easier when I'm the one who's made the incision to begin with because it's usually a lot neater. But if someone comes in acutely and they need to be stitched up, as long as it's not too deep, doesn't look too infected, and it's in a region that I'm comfortable with suturing, yeah, I'd suture. And most GPs would. So yes. Do GPs clean ears? Yes. Again, some people don't. Some GPs find it gross or don't have an interest in it. I love cleaning ears. I love it. So I only ever do sort of the water irrigation for ears. Syringing essentially. But some GPs will remove under observation with suction and some will use different tools. I quite like syringing. I find it very satisfying, and it's one of the only things you can do in general practice or in medicine in general where someone can walk out a lot better than they walked in just from one session. So yes, GPs do clean ears. Sometimes it's the practice nurse, but in my instance, I do it because I really like it. Do GPs have Dopplers? Yes, depends what kind of Doppler you mean. So a Doppler is a type of machine that detects blood flow. So in my clinic, we have Dopplers for 2 things. One, for peripheral limbs, so feet, for example, because in some conditions, so some heart conditions, vascular conditions, and diabetes, the blood flow to the feet can be compromised. And so using a Doppler helps us, assess the severity if there was any compromise. And the second thing is we have Dopplers to look for neonatal heart rates, or to look for fetal heart rates. So that's basically in pregnancy, so we can help detect Bob's heart rate as well as mum's and the placentas and all those sorts of things. So yes, typically GPs do have Dopplers. And the final one on do GPs is, do GPs have Moderna? I feel like a broken record, I'm so sorry. Some. So my practice doesn't, simply because we don't have the space, and it was getting confusing already because we did have AstraZeneca and then Pfizer, and then there was Moderna and then the Pfizer kids. So we don't personally, but a lot of GPs do and a lot of the pharmacies do as well. So that's do GPs. Let's see what can GPs says. All right, a lot of them are very similar. Can GPs do stitches? Yes. Can GPs do COVID tests? Yes, some. Do GPs do blood tests? We can order them. We can technically physically take the bloods, but usually you go to a pathology service because they've got people who are trained to do that, our lovely phlebotomists. And I'm sure there's a lot of medical legal things there as well about having someone trained under that facility take the blood to them be sent. So technically yes, theoretically yes, but often no. Can GPs do STI tests? Yes. Yes, we can. We do. There's two main ways to do it, swab or urine. STIs aren't always in the genital region though, so do remember that. So if you are a male who has sex with males or a female who engages in anal sex, we may offer a swab of the anus itself. And if you have any type of oral intercourse, we may also offer you a throat swab. So yes, we definitely do. Do GPs do ultrasounds? Some. Yeah, some do. Some have their own ultrasounds and extra training in sonography. No GP I've ever worked with does. I know of one GP I've personally been to as a teenager that did. So it's less common, but yes, is the answer, I guess. Do GPs work without internet? No. Oh, I missed one. Do GPs do ECGs? Yes. So the ECG is the sort of all the dots on the chest that looks at the electrical readings of the heart, and we certainly do that. Most instances, it'll be the nurse that does it, but we are trained to do it and read them as well. Do GPs do skin checks? I've answered that one. These are all can GPs. Can GPs prescribe Ritalin? No, but yes. So Ritalin is a brand name of a medication used for ADHD, and technically GPs cannot instigate a prescription of Ritalin. However, we can do a continuation, so repeat script, as long as lots of certain criteria have been fulfilled. So making sure that you've been seen by a subspecialist like a pediatrician, psychiatrist, etc. within the last, I think it's 12 months, but it also depends state by state. So technically yes, but no. I hate these answers too, I'm so sorry. Finally, can GPs do surgery? Some of us, yes. Typically, no. And it depends on your definition of surgery. So I cut out skin cancers. So I anesthetize the area, I put scalpel to skin, I take something out and I stitch you back up. If you consider that surgery, yeah, I do surgery. I also remove toenails, which also involves an anesthetic and cutting and maybe stitches. So yes, in that instance, yeah, GPs do surgery. Some GPs, particularly the rural generalists out there who have dual training in general practice and can be dual trained in anesthetics, obstetrics, general surgery, and a couple of others, but we're talking about surgeries now. Yeah, they do surgeries too. Also, GPs can sometimes have other jobs. So a couple of the GPs I work with also assist in theatre in the private hospital here in things like obstetrics and orthopedics. So they're kind of doing surgery. They're not the main surgeon, they're the assistant, but they're still doing surgery. So again, yes, but no, but yes. Let me think. So that's do GPs, can GPs. Let's do should GPs, and I think that'll be enough for today. Should GPs be capitalized? I'm not sure what that one actually means. Hang on. They're talking about global positioning systems. Yeah, that's not in my wheelhouse of experience and expertise. So let's go back to should GPs be seeing patients? Yes. Yes, we should. That's our job. Should GPs go on strike? Wow. No. Most GPs are actually employed by themselves, so it would be counterintuitive to go on strike. No, that's a really loaded one. Should GPs be turned on? I think that means GPS. Moving on. Should GPs' devices be in electronics? Okay, that's about GPSs, same with installed in electronics. Should GPs wear PPE? Yes, especially currently with, again, the Rona situation. Unless we're doing telehealth and stuff like that. You know, nuance. And the last one is, what should GPs wear? Whatever we want. So again, most of us are not employed by a company. We're employed by ourselves and we're our contractor under our own employment. So we can wear whatever we want. Obviously, we should dress professionally. Some of us choose to wear scrubs every day, and that's absolutely a valid choice. Some of us wear nice, pretty dresses. Some of us wear the same shirt and pants every day, as in like a uniform. I mean, there's a lot of questions there about hygiene if you wore the exact same shirts and pants every day, especially if you're doing... Anyway, doesn't matter. Point is, what should GPs wear? Whatever they want, as long as it's appropriate for the workplace. But that was really, really fun, actually, so I really enjoyed doing that. I hope you enjoyed it too. If you've got any video suggestions, let me know. But until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.